I had a patient that had been very afraid to have cataract surgery. She was an older lady. She had just this phobia or fear of having anything done to her eyes.
The the technique of Anand we the you a miracle the me body who is everybody and everything medical so get help in other work.
Thank you so much, Anand. It's great to see you. Thank you so much for having me here. Yeah, thank you for your kind introduction. Yeah, it's great to see you. It's great to be here and talk about ophthalmology. Um, you had asked me what ophthalmology is. Ophthalmology is basically the art of medicine and surgery of the eyes. So anything that has to do with the health of the eyes, the healing of the eyes, both medical and surgical. Ophthalmologists go to medical school or medical college, and then so they graduate as physicians, as doctors, and then they go through a period of training called residency training for a few years. In the United States, it's 4 years of residency training, and then they become ophthalmologists or general or comprehensive ophthalmologists. A number of ophthalmologists then go on to do further training, which we call subspecialty training, into different fields like glaucoma, which is a 1 year fellowship, or retina, which is 2 years, or pediatric ophthalmology, which is 1 year, uveitis, cornea, those are 1 year as well. So yeah, so then they graduate as subspecialists. So like I did glaucoma, so I'm a glaucoma surgeon, um, an ophthalmologist as well. So um, thank you for having me again. I look forward to answering any questions you may have for you in the audience.
Yeah, yeah, you take it what it was is and how is it different from other types of eye care.
Yes, great question. So there is also a wonderful field of optometry where those optometrists, those folks that go into optometry, they do excellent work in taking care of patients with, taking care of the patient's eyes, doing eye exams, comprehensive eye exams, prescribing glasses, contact lenses, and some of them even treat eye diseases with medicine. The difference, I think, is that ophthalmologists are doctors, like physicians. They've gone through medical school, whereas optometrists go to optometry school, which is also a graduate program. It's pretty intense as well. But ophthalmologists do surgery of the eyes, lasers, and optometrists traditionally don't do surgery and lasers. So that's like, I would say that's one of the big differences. Oftentimes, optometrists work closely with ophthalmologists, or ophthalmologists work closely with optometrists in taking care of patients. So, um, uh, the optometrist will see the patients and determine that, say, they need surgery, they have an eye problem like a cataract, or they have glaucoma, or they have a retina, a tear, or retinal detachment, and they need surgery. So then they send them to the ophthalmologist to do the surgery, to take care of that issue, and then the patient then goes back to the optometrist for their yearly eye exams. So they come from the optometrist to ophthalmology, and then they go back to optometry, and so it's like a shared care for patients, and which is really a nice model, because we all enjoy working together, serving the same patients. The idea is to take care of patients, and neither ophthalmologists or optometrists can do it, by themselves. There's so many patients that have eye problems, so we all work together, and I think that's how we can best serve our patients, working together.
And then maybe how did you find the more
Oh, thank you. Yeah. Yes, I trained, yes, as an ER physician, as an emergency medicine physician, and I actually always enjoyed seeing the eye complaints that patients came in with in the ER, and I really liked them. I thought that the eye problems were very, to me, they were very straightforward. I'm a very visual person. I remember things when I look at them. And in ophthalmology, with the eye exam, it's, when you have a slit lamp that you have the patient sit across from, at the slit lamp, you can like look into their eyes and kind of see the different structures in real time. It's a biomicroscope. So when you have a patient's eye there, you can see, is there a scratch on the cornea? Is there inflammation in the eye? You can literally, when you magnify the power on the slit lamp biomicroscope, you can see cells floating around. It's fascinating. You can actually see it. Or if they complain of blurry vision, you can look at the lens, and see, is there a cataract there? Does that explain why they can't see well? And then when you dilate them, and you look further back, you can look at the optic nerve. Are there signs of glaucoma in this nerve? Or is their retina healthy? Do they have signs of diabetes in the eye? That explains why they're not seeing well. Is there swelling in the retina? So it was I found that, the answer was right there in the eye of the patient, and that fascinated me. And I also enjoyed the watching the surgeries that were done for eyes. I thought it was pretty fascinating how you could do cataract surgery and restore someone's vision so quickly, and how happy the patients were. I was like, I want to be able to do that. So I decided to pursue further training as an ophthalmologist, and I've been very grateful for the opportunities given to me and all my mentors in training. Dr. Obertinsky is a great mentor of mine. I've been very grateful to have him, and many other physicians. So yeah, without the help of you know folks in our lives, our friends, our mentors, our family, you won't be able to do much. So I acknowledge them all. So yes.
Yeah. What are the more common eye diseases and the other room is in your bedroom?
Great question. So, because I trained I in further in glaucoma, um, I get patients that have glaucoma of the eyes. It's a Glaucoma is a blinding disease, and it is insidious. There is a strong genetic component to it, and it oftentimes, unfortunately, goes undetected for a long, long time. So, and it takes away. It starts from the periphery most of the time. It takes away our vision, and there's darkness that grows around what we call a scotoma, and then slowly it goes into the center of our vision and even takes that away. So um, my practice involves seeing patients that have glaucoma, taking care of them with drops, doing laser, um, and also doing surgery on the eyes. The other big part of my practice right now is seeing a lot of patients that have cataracts, because here in rural central Wisconsin, where I'm serving right now, there are lots of patients that need cataract surgery, and it's very nice to be able to fulfill that role for them.
Yeah.
Um, there is also uh, patients that have mild glaucoma and cataracts and mild to moderate glaucoma. And so, in those patients, when we do their cataract surgery, we're able to do minimally invasive glaucoma surgery at the same time. So you take the cataract out, and then while the patient's there, you've done the cataract surgery. You can do a small surgery in the angle of the eye to help the patients with their glaucoma. So it's a developing field. It's very exciting. There's a lot of stents uh, that can be put in the angle of the eye to take care of the glaucoma as well. There are also eye exams that I'll do here as well. So a little bit of comprehensive or general ophthalmology as well.
Yeah.
So
Are there any lab in RGB that people should be aware of?
yes, um, one of the things that affects people's overall health is diabetes. It can cause a lot of problems. Folks, it affects our small blood vessels in the body. So these small blood vessels are all over the body. So they're in the eyes, in our retina, they're in our kidneys, they're in our feet, in our skin, everywhere. And so a lot of patients that have uncontrolled diabetes, they get like hemorrhage in the eye, they get retinal detachments, they lose their kidneys, they get neuropathy, and they need like their limbs cut off because of like infections that don't heal from diabetes. So that I think is one of the big things that patients can take care of their health if possible, um, by following a good diet,
Yeah.
staying away from sugars as much as possible,
Yeah.
um, exercising, um, and then I see glaucoma, and so with glaucoma, it's good to have an eye exam as a screening eye exam. If there is a history in the family, then definitely one has to see an eye care specialist to get a dilated eye exam, looking at the optic nerves, checking for other signs of glaucoma. So I think that's very important because it's a blinding disease. And then, another thing that takes away people's vision is cataracts. And thankfully, in many parts of the world, there are amazing places that patients can go to and get their cataracts taken care of. I know in India we have a lot of centers that serve so many patients from rural communities. So it's a real joy to see that there are such good doctors and other eye care providers and hospitals. Yeah, but basically, I would say, a life-threatening disease. I think that definitely diabetes is like a very common one, and we often see that in the eyes. Yes.
You have anybody in your area?
Yes, interesting case in my career for eyes. Um, yes, basically, I had a patient that had been very afraid to have cataract surgery. And this lady, she was an older lady, and she had just this phobia or fear of having anything done to her eyes, which is understandable. So she put off having surgery for a long, long, long time. So when she came to see me, uh, she could barely get around without the help of her husband because her vision was so poor from these cataracts that had grown to such an extent. So so she came to the clinic. This was a few years ago, and I got to see her, and she had what we call white cataracts, meaning the lens in the eye looks white, like a pearl. you know. So we determined that she should have cataract surgery. And after the cataract was done, she was so happy because she said, "Now I can see my grandchildren's faces," and she was just so elated and was able to walk unaided. So that was really really nice for me to see and be able to participate in her care. Yeah.
What are the areas of vision problem that people look out for?
Early signs of vision problems that folks should look out for? Great question. Great question. So, you know, I would say that if you notice anything different about your eyes and the way you're seeing, just get seen. You could just go to somebody and that takes care of patients, an ophthalmologist or an optometrist, and have yourself checked out. If you notice that your vision is getting blurry, that you feel you're not seeing as well as you used to before, or if something seems off about your eyes, if you have dryness to your eyes, you can get seen, and there can be some therapies that can help you. Um, there's a lot of uh, things that can happen that can cause, for instance, blurry vision that uh, that shouldn't be put off. That if you notice it, you should go and have it looked at. In in some patients, like blurriness in one eye can be because of a stroke to the eye. So you want to look at that, you want to take care of it. Um, Someone may need you may need like a systemic workup. If one eye suddenly is not seeing, is very blurry. Um, um, so there are a lot of things that can cause blurriness, especially if one is an older patient. In young patients, usually, I still recommend that they get seen for their eyes. If they need prescription for glasses or contact lenses, to go get seen, get those so they see well, especially while driving. It's very important. And then if someone has just one eye that they see out of and the other eye is not functional, then it's very important to wear protective sort of glasses that are made of polycarbonate lenses that will not shatter. Because if you have one eye, we want ophthalmologists and optometrists, we want you to wear glasses that are made of lenses that will not crack in case something comes towards your eye and hits the glasses. The glasses will protect your eye. So that is something very important to consider. Yes.
How often you have the eye check?
Yes. So if you're a patient that's younger than 60 years, every every couple years, 1 to 2 years, you should have your eyes checked. Now, if you have, say, a family history of glaucoma, or if you have diabetes, then I would say you should get your eyes checked every year, irrespective of your age. Patients older than the age of 60, I would say every year get seen by an eye doctor. Yes, every year get seen, and also get like a dilated eye exam where the back of the eye is looked at, the retina, the optic nerve. It's very important because sometimes I find patients go to um, the optometrist to get glasses made or contacts made, and we're not necessarily looking in the back of the eye to see how's the health of the retina, how is the optic nerve, has anything changed there. It's very important. So I would say yearly dilated eye exams if you're over the age of 60, and then every couple years if you're younger than that.
Only the eye is you about how heavy or me how heavy are you doing good?
Thankfully, I had quite a few um, good mentors and doctors that I worked with that taught me how to do some complex and regular cataracts and glaucoma surgeries. And so I do feel comfortable taking care of some difficult cataracts. The thing that I have learned is that one has to be patient, as a surgeon, to take a deep breath. If something's not going the way you want it to go, take your time. Don't rush through anything. And I always remember, as I'm operating, what my mentor said about something. Oh, they said this, or this other doc told me to do something, this way. And the beautiful thing about eye surgery is that a lot of doctors are able to share their skills by making videos of their surgeries. So often when I have a very difficult case coming up, I will review some excellent surgeons that have shared how they handled a tough case, just so that it's at the tip of my mind. So the next morning, when I'm in the operating room and I see that lens and that patient, I just remember everything that a wonderful surgeon taught everybody through that video. And I think the other thing is by doing a lot of cases and then watching my own videos of how I operated has helped me become better. So I record myself in the operating room, and then I look at those videos to see how my hands are. Is there something that I can do better? And you often find it's like, what is my other hand doing? Why am I holding that instrument? I don't need it, or whatever that is. So yeah, that is an educational process, and I think with any kind of surgery or any other skill, there's always room for improvement. Another thing I've found is by talking to my colleagues, like I'll call some friends I did residency with or my mentors, and I say, I came across this difficult case and this is what I did. And then they'll say, very good, I'm glad that worked, but you could also try this next time. And it's like, oh, wow, I never thought of that. And so then what you have is you just have more options when you see a tough case that you're up against. You just think, oh, okay, let me try this, and if plan A doesn't work, I'll try plan B and plan C. So it's nice to have that. And I think one thing that helps with that is just humility, and just being able to share, like, oh, this is what I did, but maybe I should have done that to make it easier. And then, if you're able to share that, then you learn. But if you think that, oh, I just know this is how I do it, then, there's less room for improvement and learning. So the whole field of medicine, I think, is very humbling. And something I like about it, you think you know everything sometimes, and then you get a tough case and you're like, man. So it's very nice. It's good to always remember that to be humble and have an attitude of learning. I think it's very important. One quotation from the writings of Baha'u'llah, who's the founder of the Baha'i faith. We have the beautiful Baha'i House of Worship in New Delhi, which I had the pleasure of visiting multiple times. So I wanted to share something he said that has struck me.